tungkol sa kalusugan at sa mga aktibidad ng Kagawaran ng Kalusugan, Bicol. Ako po si Nicole R. Balhinino mula po sa Communications Management Unit ng DOH Bicol at ako ang inyong moderator para sa press conference ng Department of Health Bicol Center for Health Development ngayong November 8, 2023 dito sa Virac, Catanduanes. Tayo po ay napapanood sa live sa ating official Facebook page na DOH Bicol Chd at iniimbitahan po namin ang lahat na i-follow at i-share natin ang ating page para mas maging updated po tayo sa mga programa ng Department of Health Bicol. So tatalakayin po natin ngayong araw sa ating press conference ang mga sumusunod na paksa, ang Job Abuse Prevention and Control Week, World Antimicrobial Awareness Week, Human Immunodeficiency Virus at ang November Health Event. Kasama po natin sa ating press conference ang ating Development Management Officer 5 ng Catanduanes Provincial DOH Office, Dr. Robert John S. Aquino, ang Pharmacist 2 ng PDO Catanduanes, Mr. Jun Cesar Magtangob, ang Provincial Health Officer ng Catanduanes Provincial Health Office, Dr. Hazel Palmes. Kasama din po natin ang Catanduanes HIV Coordinator, Ms. Celia Romano. At ang Health Program Officer mula sa Health Promotion Unit ng DOH Bicol CHD, Ms. Maxine Angela Ramirez. Magandang araw po sa inyong lahat. So ngayon po ating kilalanin ng ating mga media partners na kasama po natin ngayon dito sa ating venue. Mr. Kenneth Jan Bautista mula po sa Oragon News FM. Magandang araw po. Mr. Fernan Gianan mula po sa Catanduanes Street. Umaga po. And si Mr. Danilo Garzalia mula po sa UNTV. At meron pa din po tayong paparating na media partners mula po sa iba pang media stations. At mayroon din po tayong makakasama mula sa Cisco WebEx. Kasama po natin sila virtually, pati na rin po sa ating Facebook Live sa Facebook page. Maraming salamat po sa lahat ng media partners sa pagbibigay ng inyong oras at partisipasyon sa ating press conference. So, bago po tayo magsimula, alamin po natin ang ating house rules na dapat po nating sundin para sa mga press conference ng DOH because ang mga dumalo sa press conference na ito ay kinakailangang sumunod sa mga tuntunin na itinakda ng Communications Management Unit ng DOH Bicol CHD. Na po rito ay makinig ng mabuti sa mga paksa na tatalakayin para sa mas produktibong press conference. Ikalawa, lakasan ng boses kapag magsasalita upang marinig at maintindihan ng lahat. Pangatlo, para masiguro ang kaligtasan at kaayusan, mahigpit na ipinagbabawal ang pagdala ng iligal na droga, campaign paraphernalia at anumang uri ng armas o matatalim na bagay. Ang mga katanungan, klarifikasyon o komento ay sasagutin lamang sa ating open forum. Para sa open forum, bago po magtanong, kinakailangan po nating magpakilala, sabihin ang media station na inirerepresenta at kung para kanino ang inyong tanong. Ang mga katanungan ay kailangan tungkol lamang sa mga itinalakay na paksa o health events ngayong araw. Upang mabigyan po tayo ng pagkakataon at ang lahat ng ating media partners, isang tanong at isang follow-up question lamang po ang maaaring itanong sa sundin ang journalism ethics sa lahat ng oras. Ang mapapatunayan na hindi sumunod sa mga itinakdang tuntunin ay papaalisin sa venue at kakadalo ng tatlong press conference ng DOH. So, ayun po ang ating house rules na kailangan. Para po umpisahan ang ating press conference, narito po si Dr. Robert S. Aquino, ang DMO 5 ng Provincial DOH Office in lieu of the Regional Director, Ernie Rivera, para po ibigay ang paunang mensahe.
Sa ngalan ng aming Regional Director ng Center for Health and or nagpapaabot ng kanyang pag-iinayang at alam ngayon sa ating conference dahil sa mahalaga ring aktibidad na sa aming mga kasamahan sa Doh Bicol Chd at PDO Catanduanes, sa ating katuwang mula sa Provincial Health Office na pinamamahala sa ating media partners mula sa iba't ibang bahagi ng probinsya ng Catanduanes, isang malusog at masiglang araw po sa lahat. Sa ating press conference, ibabahagi ng ating pagsalita ang mga napapanahong health issues ngayon gaya ng drug abuse and prevention and control, World Antimicrobial and Awareness Week at Human Immunodeficiency Virus at iba pang health events sa buwan ng Nobyembre. Sa darating na Drug Abuse and Prevention Control Week na may temang People First, Stop Stigma and Discrimination, Strengthen Prevention, binibigyang diin ng kagawaran ng isang people-centered approach sa pagpuksa ng stigma at diskriminasyon. Bahagi din nito ang pagpapaigting ng pag-iwas sa droga at sa masasamang bisyo lalo na sa mga kabataan. Kasunod din ito ang World Antimicrobial Awareness Week na may temang Preventing Antimicrobial Resistance Together. Ito ay naglalayong magkaisa ang iba't ibang sektor sa pagpigil ng antibiotic resistance. Ang walang habas na paggamit ng mga antibiotiko ay nakakasama sa ating kalusugan at resulta nito ang antibiotic resistance. Dahil dito, magsasagawa ang Department of Health ng iba't ibang aktibidad para tugunan ang isyong ito. Sa patuloy naman na banta ng Human Immunodeficiency Virus or HIV sa rehiyon, patuloy din ang pagpapatupad ng Department of Health ng iba't ibang estratehiya upang maipaalam sa publiko kung paano ito maiiwasan at kung ang programa ng gobyerno para dito. Higit ding paiigtingin ang pagpapalaganap ng mahahalagang impormasyon upang maiwasan, at ma-manage ang HIV. Ang mga iba't ibang pagdiriwang sa buwan ng Nobyembre na nagbibigay diin sa mga isyu at mga paalala tungkol sa kalusugan ay ibabahagi sa atin ng ating Health Program Officer mula sa Department of Health Promotion Unit. Kami po sa Kagawaran ng Kalusugan ay taos-pusong nagpapasalamat sa inyong lahat sa pagbibigay ng oras para dumalo, makinig at makialam sa napapanahong health events sa ating rehiyon. Naway magpatuloy kayong maging kaagapay namin sa pagsulong sa isang Healthy Pilipinas. Dahil sa Healthy Pilipinas, bawat buhay ay mahalaga. Maraming salamat.
Salamat po, Dr. Aquino. So, gusto din po namin i-acknowledge ang mga bagong dating po natin na media partners na Sir Danilo Versalia mula po sa UNTV, si Sir John Raymond Tatad, Tatad, PIA po, Radyo Pilipinas. Miss Arlene mula po sa Radyo Pilipinas. Edmo, Sir Edmo. Ako sa PIA Catanduanes. Ed, sorry po. So, dumako na po tayo sa ating unang paksa ang tungkol po sa Drug Abuse Prevention and Control Week na tatalakayin po ni Dr. Hazel Palmes, ang Provincial Health Officer ng Catanduanes Provincial Health Office. Morning to our participants in this press conference.
drug abuse prevention and control. In support to the celebration of Drug Abuse Prevention and Control Week, the provincial government through the provincial health office implements health promotion activities, and one of it is the implementation and institutionalization through an ordinance of drug-free workplace. So Catanduanes, being an integration site, implements health promotion activities and in support is now sponsoring an ordinance in support. So this ordinance supports to the executive order of the former President that called for institutionalization of the Philippine anti-illegal drug strategy, which outlines a balanced effort of the government to strengthen the campaign against illegal drugs and contribute to the international efforts to counter the worldwide illegal drug problem. Also, under this executive order, specifically in Section 4, calls for all government units to adopt their respective drug-free workplace, and this also ordinance also supports the Dangerous Drug Board Regulation number 13, series of 2018, wherein it mandates a creation of a drug-free workplace policies. So in a nutshell, the ordinance contains that all provincial government offices will be drug-free, meaning we will have both the elective and the permanent personnel we will have no drug dependence. Second, that we will have a rehabilitation program. So if we will find out that upon, upon drug testing and confirmatory that there is dependence, so we will implement a drug rehabilitation program for the provincial health office, and we will institute policies on how are we going to implement. And also, there will be a drug dependency examination, and also under the healthcare providers network, appropriate referral to appropriate facility will be facilitated. So this is the program of the provincial board. In addition, uh, we are strengthening the existing community community drug rehabilitation program in partnership with the stakeholders. So this is ongoing because we started it in 2018 of President Rodrigo Duterte. So now we are going to have more strengthened referral. So if a client is found out to have a mild substance use disorder, this will be handled by the LGU 14 of the 11 municipalities. But if the findings that the patient would undergo general intervention under the LGU 14. So if the client is found out to have a moderate substance use disorder, we are now working on a referral system wherein intensive outpatient program will be provided to the patient. So now we are working on a MOA with Malinaw Treatment and Rehabilitation Program and DUMOS, which is now currently working on its license and certification, uh, that they will provide the outpatient care, and Malinaw will cater to the severe substance use disorder, patients with severe substance use disorder. So the policies would be that under the IOP or for the moderate, the provincial government actually has provided funds to subsidize the DOMOS for the provision of free services. So first, it would be for the first 7 months. Then after that, the aftercare. So the first 7 months, it would be given free for the clients ever. As counterpart in the LGU, they'll provide for the patient. Then for the intense for the severe, which is the residential treatment, which we have in Malinaw, so that we are still working on the MOA, it will now be shouldered by the LG. So at least if we could provide the IOP treatment here in the province, our clients will be able to say for their fees. So this is now our ongoing activities to ensure that Catanduanes will contribute to a are also working on with other stakeholders like the academic, like the council, to cater also to the students. So we are providing for a technical assistance to craft for policies and also technical assistance for the conduct of drug testing and surveillance. So under our office. So yun po yung ating technical assistance sa academic. And we are also partnering stakeholders in the provision of the aftercare program for the reintegration of our people. So like the DOLE, the TIAC, the Provincial Agriculture Office.
Thank you so much po, Doc Palmet, for the presentation. So, moving on po, i-acknowledge lang po ulit natin ng kasama po natin partners sa WebEx Live si Mr. Ken Cabaltera mula po sa Idol FM. Miss Melissa Manzanilla mula po sa Care 104.3 The Week. Magandang umaga po sa inyo. So, sa susunod po natin na paksa, tatalakayin naman po ni Mr. Jun Cesar Magtangob, Pharmacist 2 mula po sa Catanduanes Provincial DOH Office ang tungkol sa World Antimicrobial Awareness.
Morning, November, behalf of the DOH, appreciate your support in the campaign to raise awareness of AMR. In my presentation, develop patients of AMR on the AMR problem, AMR solution, AMR. Can break down the word anti and microbial. Anti means against, microbial, microorganisms. Microorganisms include bacteria, viruses, fungi, and parasites. Find the two antimicrobial means anything we could use against bacteria, viruses, fungi, and parasites. Antimicrobials are substances present in products that kill or control the spread of microorganisms. And the word resistance. Resistance, on the other hand, means ability to prevent something. In the case of antimicrobial resistance, it is essentially the ability of microorganisms to prevent being killed or controlled by antimicrobials. Antimicrobial resistance, ability of microbes to survive, grow, and multiply despite the presence of antimicrobials that would normally kill or inhibit their growth. For bug, a term used to refer to resistant pathogenic microorganisms, especially bacteria. Ang superbug ay mga bakterya na hindi tinatablan ng iba't ibang antibiotics na dating ginagamit sa paggamot laban dito. Review and communicable disease. or communicable disease, nakakawang sakit. A disease that are caused by infectious agents that are transmitted to other people from an infected person, animal, or other source in the environment. Infectious agent or pathogen, also known as germs or disease agents. These are what causes the disease or infection. Bacteria, viruses, fungi, and parasites. Elements of chain, Elements of the chain of infection. First, the disease agent, infectious agent that causes the disease, enters the reservoir, the place in the environment where the pathogen lives and multiplies. Example, people, animals, soil, and water. Then, portal of exit. The way the infection agent leaves the reservoir to spread to others. Mode of transmission. How the disease agents is spread or passed on from one to another. Direct or indirect contact, ingestion, and inhalation. And next is portal of entry. The way the agent enters the body. Example, respiratory, gastrointestinal, genitourinary. And susceptible host. The person who is at risk for developing an infection. How does AMR develop? Number one, infection. The stage when the infectious agents has entered the host body. Then, kapag nakapasok na sa host, proliferation. This is the stage when the infectious agents has evaded the body and its immune system. It reproduces and multiplies exponentially, even in the absence of symptoms. Proliferate na. And next is illness, the stage when the clinical manifestation of the disease are present in the infected person. Kapag may sakit na tayo, manage natin. And management and cure. To effectively treat the infection and avoid the development of AMR, proper management and cure should be done. Infection are best managed and cured once there is a correct diagnosis by a physician, which allows to choose an effective antimicrobial treatment. Kapag na-mismanage naman and na-misuse yung cure, dito na lalabas yung microbial resistance or the AMR. AMR occurs when the microorganisms evolve when they are exposed to antimicrobial drugs, which in turn makes the drug ineffective. Kapag may AMR, hindi naman natin nasugpo yung sakit. So mapapasa natin siya. So dito na papasok yung number 6, yung spread. The spread of AMR occurs naturally as genetic change and continue over time. However, the misuse of antimicrobial accelerates the process. Examples of misuse includes the use of antimicrobials to treat viral infection. What promotes AMR development? Natural tendency of microorganisms to evolve. Drug resistance is a natural evolutionary phenomenon. When microorganisms are exposed to an antimicrobial, the more susceptible organisms succumb, leaving behind those resistant to the antimicrobial. They can then pass on their resistance to their offspring. The next, irrational use of antimicrobials, wrong medicines. wrong dose, wrong indication, self-medication, failure to complete therapy, failure to follow up through after failed therapy. Then, in agriculture, animal husbandry, use of subtherapeutic doses of antibiotics used in animal rearing to promote growth or prevent disease. Next, lack of quality medicines, suboptimal drug concentrations, poor quality of drug products, use of expired medicines, and poor access to antimicrobials, forces patients to take incomplete courses of treatment, financial incapacity of patient, dependent on the availability in the pharmacies, hospitals, especially in the rural areas. Poor infection prevention and control. The lack of systems and relevant data which can be used to develop programs and policies for prevention and control. Example, lack of clean water system in provisioned areas wherein there is a high prevalence of diarrhea. Weak surveillance system. Lack of regular collection of and report on the relevant data on drug resistance. And the insufficient investment in new research in developing new antimicrobials. Current empiric therapies, which are ineffective, still have no alternatives as treatment to infections. The implications of AMR. Impact to patient. Resistance to treatment in some of the most common infections in the world. Increasing use of older, less effective techniques in controlling infections will be required. Increasing burden of caring for individuals, their families, and society. Impact to community. Resistant bacterial spread reflects both additional infections caused by resistant strains and replacement of susceptible strains by resistant strains. So ano, kahinatnan kung hindi malabanan ng AMR? Kung hindi malabanan ang problema sa AMR, ang mga antimicrobial na meron tayo ngayon ay hindi na magiging epektibo laban sa mga infeksyon, paglala ng sakit, at maaaring humantong sa pagkamatay. Philippine response to AMR problem. In 2012, country's situational analysis was commissioned, and the evidence generated from this enables the government to highlight the gravity of the problem and the gaps in addressing AMR. In 2014, the national government created the Interagency Committee on Antimicrobial Resistance, or the ICAMR, which is composed of the Department of Health, Agriculture, Trade and Industry, Science and Technology, and the Interior and Local Government. Efforts to include the environment and the education sectors are also underway. In 2015, the Philippine ICAMR launches the first Philippine Action Plan to combat AMR. And in 2016, antimicrobial stewardship trainings were initiated and the development of MOP for implementing AMS programs in hospitals. And in 2017, the conduction of National Point Prevalence Survey. In 2018, the launch of the Philippine Action Plan to combat AMR, 2019 to 2023. And in 2019, the publication of the National Antibiotic Guidelines and the MOP on AMS in primary healthcare. Administrative Order Number 42 Series 2014, the creation of the Interagency Committee on Antimicrobial Resistance, or the ICAMR. The Philippine Action Plan on AMR, 2019 to 2023. key strategies and the Philippine Action Plan combat A- to combat AMR. Conduct ICAMR meetings to antimicrobial resistance surveillance program. Ensure uninterrupted access to safe and quality and assured antimicrobials. FDA responsibility to regulate use of antimicrobials and to ensure safe and quality assured antimicrobials. No prescription, no dispensing policy. Regulate and promote the rational use of antimicrobials. Antimicrobial stewardship program. Point. Implement appropriate measures to reduce infection across all settings, to promote innovation and research on AMR, and to improve awareness and understanding of antimicrobial resistance to the effective communication and education. Behaviors that can decrease the burden or slow the progression of AMR. Avoiding infection. If there's no infection, there's no need for antimicrobials. Proper hygiene. Example, hand washing, vaccination, boosting immunity, clean environment. Clean environment to prevent proliferation of vectors and reservoirs. Community cleanup drives to avoid sources of proliferation. And cooking food thoroughly to kill the antimicrobials. Next, proper management of the communicable disease. Consult a physician. In order to treat infections effectively, a proper diagnosis should be established and the proper antimicrobial should be prescribed to avoid spreading the infection and developing resistance. Next is proper etiquette. Proper cough and sneezing etiquette, covering your mouth and nose, face away from other people, and avoid close contact with other people. And the next is quarantine. Quarantine and rest helps to avoid the spread of infection, especially for highly contagious diseases. Responsible use of antimicrobials. Prevents prescription. Only use antimicrobials or antibiotics when prescribed. Next is compliance. Take antibiotics as directed. Never underdose or overdose. The next is finish therapy. Treatment are most effective when therapies are taken as directed. Completing the whole course of the prescribed medicines, even the symptoms disappear in the middle of the treatment. Next is correct dose. Take the appropriate dose or as prescribed by the physician. Skipping doses should also be avoided to ensure the effectiveness of the treatment. And lastly, never share. Sharing prescriptions and unused antimicrobials without a proper prescription with other people having similar symptoms may lead to inappropriate treatments, causing the development of AMR.
Alright, thank you so much po, Mr. John Cesar Magtangob mula po sa PDO Catanduanes. So, moving forward po, bibigyang linaw naman ni Ms. Celia Romano, Provincial HIV Coordinator ng Catanduanes Provincial Health Office, ang tungkol sa Human Immunodeficiency Virus o HIV.
Hello, good morning po. So, ang ipipresent ko po is ang data from the HIV, AIDS, and ART Registry of the Philippines. So, as of May 2023, ang total reported cases po is 1,256. Average cases per day as of May, 48. Male, 1,186. Female, 70. And those with advanced HIV disease at 323. Total reported deaths, 132. For the incidence po, NCR, by region of residence as of May also, for NCR, 213, Region 3, 149, and Region 7 at 108. For the proportion of newly diagnosed youth by mode of transmission, male to male, 303, which is 77%. Sex with males and females, 48, 12%. Male to female sex, 43, 11%. And no data, 2 at 1%. We're going to proceed with the new HIV/AIDS cases in Catanduanes. Slide po, sir. Okay. For the new HIV/AIDS cases in Catanduanes, in the year 2021, 22, and 23. So for 2021, 9, 2022, 15, from January to June 2023 is 5. HIV/AIDS cases by sex in Catanduanes, 71. That's from 1984 to present. For the cumulative HIV/AIDS cases in Catanduanes, from 1984 up to 2021, 22, and 23. 2021 at 51. 2022, 66. And 2023, 71. So that's cumulative cases from 1984 up to present. HIV/AIDS cases in Catanduanes by age group, 1,400 from 1984 to present. Less than 15 years old, 1. 15 to 24, 15. 25 to 34, 43. 35 to 49, 10. 50 and older, 2. Contextualizing the expanding epidemic, understanding the risk and behavior of the key populations, and access to HIV prevention, testing, and treatment services. Key and vulnerable populations, men having sex with men, transgender women, female sex workers and people in prostitution, people who inject drugs, young key population, women and children. So what is happening? Not all key and vulnerable populations have access to preventive services and or are practicing protective behavior. Not all PLHIV are diagnosed, and not all diagnosed PLHIV are on life-saving ART. Understanding the risks and behavior of the key populations and access to HIV prevention, testing, and treatment services. What needs to be done? Increase knowledge on HIV transmission prevention and services, provide combination, prevention and access to services, and prevent new HIV infections. Retain HIV negative status. Ways forward, implement combination prevention through condom use, PrEP or the pre-exposure prophylaxis, medicine taken to prevent getting HIV. U equals U messaging. Undetectable equals untransmittable, or U equals U, is a public health message designed to reduce HIV stigma and help communicate the scientific consensus that HIV cannot be sexually transmitted when a person living with HIV has undetectable viral load. And targeted community strategy for key populations and vulnerable populations. Multi-sectoral approach and collaboration, PSWD, PHIC, DepEd, CHED, DILG, LGUs, CBOs like Gentleman Bicol and Gayon Bicol, patient support groups, etc. Ways forward. Establish additional treatment hubs in every province. Existing HIV treatment hubs are the BRHMC, BMC, and Masbate Provincial Hospital. Establish HIV care, primary care facilities in the RHUs, DHOs, and other clinics. Expand testing services. Expand screening services in RHUs and CHOs, hospitals, laboratories, and community-based screening. Establish additional HIV confirmatory laboratories in every province. Existing confirmatory lab is in BMC. Naga. Self-testing kits. Addressing the barriers to access to services, including stigma and discrimination, and the integration of HIV services. National Tuberculosis Control Program, Maternal and Child Care Health Program, the National Voluntary Blood Services Program, and the Adolescent Health Program Health Promotion Unit. Key messages. Early diagnosis is key to successful treatment of HIV. Get tested. It's better to know your status. HIV/AIDS is not a curse. It is an illness that can be defeated. So there are a lot of persons living with HIV taking antiretroviral drugs that are living a normal, healthy life. So let's remove the stigma and discrimination. Paano maiwasan ng HIV? Abstinence, be mutually faithful, consistent and correct condom use, do not use drugs and alcohol, education, and early detection of HIV. So that's it. World AIDS Day is on December 1, 2023.
Thank you so much po, Ma'am Romano. So, for our next topic po, November health events na tatalakayin naman po ni Ms. Clara Nieses, health program officer mula sa Health Promotion Unit ng DOH Bicol Chd.
Hello po, sa ating
media partners nakatutok sa advertising. So I will be sharing with you today ang ating mga health events na one. So first off, this month we are observing lung cancer awareness. So itong month-long campaign natin ay focused on raising awareness about lung cancer. So this event provides a platform to inform the public about the risks associated with lung cancer, the importance of early detection, and the available resources and support for patients and their loved ones. So it is important to note that lung cancer po ay second most common na uri ng cancer dito sa Pilipinas. Kaya po mahalaga na paraan kung paano. So lalong-lalo na pag-iwas sa paninigarilyo. Also, this month we are celebrating National Children's Month. Also, this month we are to give Filipino children access to an good education. So, alam mo po natin, it's not para sa kabataan yun. It will take all levels, all sectors of society to address child health. Pero sa family level, rin natin gawin para ma-improve ang kalusugan ng bata. Kasama na dyan ang pag-promote ng physical activity, pag-encourage na kumain ng masustansya, and of course, pagsiguro na bakunado sila laban sa infection. So this month also is filariasis awareness month and malaria awareness. So every November, kinocommemorate natin itong mga events to raise public consciousness about the enduring public health. So ang malaria po and filariasis ay pareho po siya vector-borne diseases and are similarly influenced by climate and social factors. So it is important also to take note na may iwasan po natin. Na ito sa pamamagitan ng pananatiling malinis ang ating kapaligiran. So this month, we are also commemorating or observing traditional and alternative healthcare month. So this month po, nire-recognize natin yung importansya ng traditional and alternative healthcare or medicine to Filipinos in providing essential healthcare. This is valuable to people who do not access to care and immediate nursing, specifically to locals in Saudi. Up next, sa second week of November po, meron po tayong National Skin Disease Detection and Prevention Week. So this was a law by former President Gloria Macapagal-Arroyo to promote adequate skin care and self-awareness when it comes to taking care of one's body. So it is important po na alagaan din natin ang ating balat dahil po ang skin is the largest organ of the body, which covers virtually the entire surface area of our body. It serves as a shield, protect people from harmful external elements such as bacteria, chemicals, and even for coldness. So, ina-urge po natin ang lahat na magkonsulta po sa mga medical professionals kapag may na-notice po tayo na unusual sa ating balat. Hindi po dapat natin dina-downplay yung mga signs. Kailangan po natin isiguro na it gets attended to before lumala pa. So up next, on the third week of November, we have Drug Abuse Prevention and Control Week, mentioned earlier. So this week, we are promoting public awareness against the evil effects of illegal drug use as well as the public's cooperation with the government anti-drug. On the third week as well, we have the National Consciousness Week against counterfeit medicine. So this event aims to highlight public awareness on the issues regarding the proliferation of counterfeit medicines and to educate consumers as well on the potential harm of counterfeit drugs and provide guidelines on how to avoid becoming victims of fake medicine. So kasama po natin dito ang Food and Drug Administration sa pag-encourage sa publiko na mag-report po ng mga pagbebenta or distribution ng mga suspected, unregistered, or counterfeit na gamot. So existing efforts to prevent, detect, and respond to the proliferation of substandard, spurious, falsely labeled, and falsified counterfeit medical products ay malaking threat po ito sa public health and safety, and and can only be sustained through the vigilance po ng ating. On the third week also, we have National Biotechnology Week. So this is celebrated to highlight the many contributions of biotechnology in agriculture and food security, equitable healthcare services, development of industries and business enterprises, sustainable environment and economic development, among others. So different national government agencies, NGOs, state colleges and universities, and other private academic institutions are participants in this event. On November 7, yesterday, we had National Food Fortification Day. So this event aims to advocate and promote food fortification to address micronutrient deficiency. So ang food fortification po ay addition of one or more essential nutrients to food, whether or not it is normally contained in the food for the purpose of preventing or correcting a demonstrated deficiency of one or more nutrients. Sa November 14 po, we will be having World Diabetes Day. It is the world's largest diabetes awareness campaign, and it draws attention to issues of paramount importance regarding diabetes and keeping it in the public and political spotlight. On November 17, we have World Prematurity Day. So during this day, we, together with other organizations and individuals, have activities, special events, and other activities to commit action and help address preterm birth and improve the situation of preterm babies as well as their families. Up next is on November 19, we have World Toilet Day. We should inspire action to tackle the global sanitation crisis and reach the 3.5 billion people still living without safely managed sanitation. So during this day, we highlight the importance of eliminating open defecation as well as promoting proper hygiene such as hand washing. Earlier, we discussed World Antimicrobial Awareness Week, VICER. So during this week, we improve awareness and understanding of AMR or antimicrobial resistance. On November 23 to 29, we have Population and Development Week. We highlight the need for an invigorated and intensified campaign to address problems in the pace of the Philippine population growth and the country's capability to provide for the growing nation. On the third Wednesday of November, we have Chronic Obstructive Pulmonary Disease Awareness Day or COPD Day. So this is to raise awareness of COPD among the public all around the world. So during this day, we raise awareness through a variety of campaigns and activities aimed at highlighting the importance of education about the disease and finding solutions to reduce the disease global burden. On the third Sunday also, we have World Day of Remembrance of Road Traffic Victims. This event aims to remember all the victims of road traffic incidents, accidents also, and those seriously injured on the roads. So we acknowledge the crucial work of the emergency services and draw attention to the generally trivial legal response to culpable road deaths and injuries. Also, we advocate for better support for road traffic victims and victim families and promote evidence-based actions to prevent and eventually stop further road traffic deaths and injuries. We also have the National Conscious Day of Elimination of VAUSI on November 25, and in line with that, also we have the 18-day campaign to end violence against women. That's on November 25 to December 12. So kasama po natin ang iba't ibang mga ahensya sa gobyerno para sa pag-raise ng awareness sa problema ng violence and the elimination of all forms of violence against women and girls. So, ayan po ang ating mga health events ngayong November. Para po sa iba pang kaalaman sa mga health events na ito, regularly po tayo nagpo-post sa ating official Facebook page na DOH Bicol Chd. Meron din po tayong programa, ang Chikahang Pangkalusugan, kung saan pinag-uusapan po natin ang mga health events na ito. So, maaari mo niyo po yun mapanood sa ating official Facebook page as well at mag-subscribe na rin po kayo sa aming official YouTube channel na DOH Bicol Chd. So, ayan po, maraming salamat po. Maraming salamat po. So, marami po tayong mga health events buwan-buwan, lalong-lalo na po ngayong buwan ng November. At inaasahan po ng DOH Bicol Chd na katuwang po namin kayong lahat sa pag-spread ng awareness at sa pag-celebrate po ng mga health events natin sa DOH Bicol Chd. So, nagpapasalamat din po kami sa mga resource speakers natin sa kanila presentation sa ating tinalakay na mga paksa sa press conference ngayon. So, dumako naman po tayo sa ating open forum kung saan ang ating media partners ay mabibigyan ng pagkakataon na magtanong at maliwanagan sa mga paksang natalakay. Sa muli, pinapaalala po namin ang mga sumusunod na tuntunin. Una na po ang pagpapakilala. Sabihin po ang inyong pangalan, ang media station at kung para kanino po ang inyong tanong. Susunod po, ang mga tanong ay kinakailangan tungkol lamang po sa mga tinalakay na usapin. Upang mabigyan ng pagkakataon ng lahat ng media partners, isang tanong at isang follow-up lamang po ang maaaring itanong ng bawat isa at sundin po natin ang journalism ethics sa lahat ng oras at pagkakataon. Maraming salamat po. Para po sa ating unang katanungan, narito po si Mr. Ray Boton para sa kanyang question.
Good morning po. Ray Boton po ang PZRH News. Ang question ko po ay para kay Dr. Hazel Palmes po. So, nabanggit po yung topic nung meron tayong Drug Abuse Prevention Week po. And ang tanong ko po is para doon po sa rehabilitation na mga surrenderies po sa Catanduanes. If mayroon na po bang yung proseso po ng rehabilitation is yung DOH Catanduanes or yung sila po ba yung nagmamanage po ng rehabilitation po nito? And mayroon na po bang gumaling sa mga surrenderies po natin?
Thank you, sir, for that question. So, for the information of everyone started embarking on the drug prevention and control program in the province since the time of it's a continuing program of the government, of the provincial government, all the 11 municipal local government. Yes, we have a rehabilitation program. During this time, in the time of President Bongbong Marcos, we strengthened, as mentioned earlier, the primary health care referral. Meaning, depende po sa substance use disorder category. So, if we have a PWOD or non-drug user which is diagnosed to have a mild substance use disorder, the core team, the LGU core team of the 11 municipality handles the program. So it is 1 month general intervention program and 6 months community-based rehabilitation program. If the case is diagnosed to be moderate substance use disorder, like before, we were working with Malinaw for the intensive outpatient program. However, na-stop yun during the pandemic. And now we are revitalizing it, our partnership. As I mentioned earlier, we're working on a MOA with Malinaw. Since we have an existing institution in our province, the Doh Passes, who is in the process of having their institution to be accredited by the DOH. So we are planning to have for the moderate, the intensive outpatient program here in the province so that it would defray expenses on the end of our PWOODs. And as I mentioned earlier, that the provincial the government, through its PAPS program, has allocated 2 million for the free services for the intensive outpatient care to be handled once the MOA will be approved and signed by both parties here in the province. It will be the intensive outpatient services here. So the counterpart of the MLGU, that's the part of the provincial government. On the part of the municipal government, they will only shoulder also in a form of assistance for their clients for the so the for the moderate it would last for 7 months. That's then the aftercare program in partnership with our stakeholder, it would it would be for the people. So we are partnering with stakeholders like the provincial OPAG for the provision of livelihood, plus other religious partners for the intervention of care program. Yeah. Then for the severe substance use disorder, as I said earlier, we will be having a MOA with Malinaw treatment and rehabilitation program. So before sila yung IOP plus for the severe, which is the residential treatment and rehabilitation program that would last for 9 months. So yung 9 months, na inano po natin sa Malinaw, nag-oo naman yung 11 LGUs for to shoulder the finances for the period of 9 months in Malinaw. But the aftercare program, i-refer back nila po sa atin, sa Dumos, na sa ganun po, libre naman po sa sa kasabayan. So yun po yung plano ng provincial government. Sabi ko nga, to contribute for a drug-free Philippines. Of course, drug-free province. Yan. At pangalawa po, yung ang pinaka-importante po, yung ano po, yung referral ma-facilitate po ng government to the provincial level.
Yung follow-up question ko po kasi nabanggit mo Doc is yung merong moderate and severe. Meron na po bang mga surrenderies tayo na nag-fall doon sa moderate and severe, and yung follow-up question ko po is meron na po bang na-rehabilitate o gumaling na po dito?
Actually, since 2018 po, meron na po. Pero sa ngayon po, na-stop kasi during the pandemic. That is why we are revitalizing the program. So, since ng last pandemic, hindi na sila nagsasabit ng report sa Provincial Health Office. Yun po yung pinapakiusapan ko during our POPS meeting and the PADAC joint meeting na sana dumaan po sa PHO para makareport kami diretso sa province. Kasi po, during the time po ng yung DILG pumasok po, na ang bawat municipal government dumadiretso na yung report sa sa DOH. Yun po yung utos ng DILG. Ngayon po nakiusap po ako para po makita muna ng province kung ilan po talaga. But now we are revitalizing para pong reporting malaman natin. Yes, marami na pong gumaling. And ngayon din, meron ding ongoing that I cannot tell you the figure kasi nakahandle po na. Oo po, very po. So meron po tayo. So ngayon po, yung ating client, yung sa plea bargaining, yung sa PWOODs, wala na po daw nag-surrender sabi po ng PNP, but we are yet to revitalize the program. Parang meron pong mag-voluntary surrender.
Ayan. Thank you so much po, Sir Doc Lisa. So, next po si Sir Fern.
Question po ma'am. Arvin Tabusot ng Catanduanes Tribune. Ma'am, kailangan pa kasama itong 1984 data sa pinag-uusapan po natin ngayon. Wala po.
Sinasama po siya kasi from nung nag-start siguro until ano, kaya cumulative yung bilang nila.
Okay. Ma'am, next question po is, 2021 meron tayong 51 and 66 sa 2022 and 71 from 2023. Asa na po sila ngayon, ma'am? Kumusta na po sila? Magaling na po ba? Or ongoing na po yung treatment?
Actually, sir, ito pong cases na to is hindi naman to lahat nasa Catanduanes. So, merong ano lang, kumbaga naka-address or ano, pero hindi naman to din lahat sa Catanduanes po na-detect. So, marami po kasi tayong mga testing sites, ganyan. Yung iba, sa Metro Manila, yes po. So, hindi ibig sabihin na 71, lahat po nandito. Of that po, meron na pong, since kung na-detect na sila, magsisik sila ng ano. And, so, wala po siyang cure, di ba? Treatment meron. Iba po si cure sa treatment. So, si antiretroviral therapy, yun po yung magpapaprolong ng buhay ng ating
Okay, so next po, si Sir Ken.
Hello po, ma'am. Ken po, isa po ba radyo radio? Or, ma'am, ma'am, ano po ang hakbang ng kagawaran tungkol sa mga patient nahihiya o mas pinili na tungkol sa kanilang sakit? Lalo na yung mga
Kaya po ano, ini-intensify po ngayon yung ano, mga pa-training, yung mga advocacy. Sa ngayon po, madami na pong na-train na mga for counseling and testing ang DOH. So para mas mapalawak natin yung IEC, yung pag-encourage sa kanila na wag matakot to know their status. And kasi sabi nga, hindi naman siya first. So kung malaman mo yung status mo, and then pag-seek ka ng tulong, nandiyan naman yung gamot, meron namang mga financial support na pwedeng i-provide. So, ibig sabihin, kayang mabuhay ng normal. Kaya pong mabuhay ng normal. So, kailangan lang talaga for them to know their status at saka yung mga support group naman. And meron na po tayong pina-follow na confidentiality. Kaya wala po sigurong ano na dapat na matakot na mag-seek. Magpa-test.
So much po, Sir Ken. Para po sa ating next question, si Sir Fernando.
nangyayari. Um, dapat sila na
Mayroon pong ano, naka-ART. Meron po. Kasi may mga reports naman pong sinasubmit. So, meron po na naka-ART. Ah, kasi po hindi naman, sabi ko nga yung ako din per se, hindi ko rin masasabi na kung sino-sino sila. Kasi po dun nga sa confidentiality. So, kahit po ako yung program coordinator, hindi pa ako entitled na malaman kung sino-sino po sila. Pero ang data po niyan, meron pong data niyan. Kung ilan po ang naka-ART, ilan po ang hindi na po continue, ilan po ang namatay. Kasi meron pong ano, Sa treatment hub natin, andun po yung mga records. Kung meron mang hindi na ire-report, ah, baka nasa ibang ano din sila, ibang mga lugar. Kasi during the ano po, nung pandemic, may mga ways po for these clients na makakuha po ng gamot para dire-diretso. Opo, si Arlene Bagadjo, PBS Radyo Pilipinas. Yes, kay Dr. Tungkol po status ng yung keywords at mga nag-surrender sa Catanduanes. Kasi ano ba yung strength and weaknesses ng community rehab program ng atin? Dahil sa mga na-monitor natin sa drug bypass operation, merong mga tayo na sila ay loob. Kaya ang tanong ang ating program at paano ito
Thank you, Ms. Arlene, for the question. So, sabi ko nga po, nire-revitalize po natin kasi medyo ano po tayo. And I would like to, i-clarify lang po natin, yung sa part po ng health, sa community rehab, is to, lang po, sa health, lang po kami aspect. So, determine the substance use disorder kung meron yung isang surrendering. At the same time, doon po sa mga nag-avail ng free bargaining. Okay? So, once ma-determine natin kung meron siyang substance po, depende po saan siya Yes. Monitor po. So, while they are fit test, monitor po natin sabi ko nga health aspect kami ng yan. So sa end ng health, once they will be enrolled to treatment, depending on the category or the severity of the SUV, substance disorder, meron po silang schedule for drug testing. So yun po yun. Meron din po yung pulisya kung ilang beses na upon nasa enrolled na for back po.
Kasi yung iba kasi, tawag ay nagkakaroon sa PA through our pharmacist po, yung mga ganyan na nakikita, actually meron na po
Naghanap sa farm. Po na kumbaga for them to practice. Paano? Meron po tayo mga fear dumadami. Po dumadami kasi nandiyan yung availability. Dati pero So, hindi man siya mandatory. Paano naman yung viral load. So, nag-ART na siya. At may possibility. Sumabik. Safety. Pero hindi naman inaano na, ito yun. Oo. Libot ng libot. May mga boyfriend, sabi ng bading, sabi ng kaibigan. Paano mo naman alam daw ang sabi nung kanilang kasama? Paano, anong intervention pwede gawin ng or ng natural para ma-encourage kung take care yan. Ano nga po because of RA 11166, hindi po tayo pwedeng mag-contact trace. So like sa TV po, di ba, pagka meron, pwede ka mag But with HPV, unless po yung nagpa-screen, yung nagpa-test, confirm, kusa niya pong sasabihin kung kanino, kung sino. Yun po. And isa pa, kailangan ma-convince niya kung si partner dapat yes po. So yun po talaga. Sobrang malaking bagay. So you know, you have that. At wag na. Huwag na maghanap ng kadama. Anyway,
Matanong din, may free HIV testing ang DOH or yung PHO?
pre-HIV screening po, available po ito sa
Sa-
mga RHU.
Anytime?
Yes po. We have ano po, ang DOH po, program PBS. Tama yan. IV counts testing. Mga staff po ito, health personnel. Kung now, some pagkain sure. Yan siguro nag-program po sila.
Opo, na-endorse na po namin.
Okay po. Kasi lumalabas po dito. Mayroong
na yung mga noon po katulad ng paper and then pwede
Catanduanes. Program, kagaya pa po ng maternal care. So, arin po, meron stream testing. Once ay magkataon, so, hindi po siya ang reminiscent po kasi sa inyo kanila rin is lang natin tapos yun po yung lumabas. Bigla siya. Hindi natin masabi marami lang kaya the practice to the big but rather challenge how are we going to educate the students? Sabi ko, pero na-measure, napag-start din na ngayon daming interview dito sa ating din kailangan na kapag tapos sa saan pa matulungan ko siya so isang ano na lang so yun po yun ngayon talaga it's the right time na para malaman lang natin ay and that's it Catanduanes global po yan ang importante sa part of population awareness that right and pagpipilihan that's lang po natin na Makaning so alam natin how to prevent it. So yun po yung intensified program para po ma-increase yung access to population services para po sabi nga natin, prevent po may TB dahil immunocompromised sila. Yan. Sa maternal care, nandiyan na siya sa National Voluntary Test po yan. Lahat ng ano po, lahat ng na kuha natin sa mobile blood station program, test po yan for blood transmissible infectious diseases. Kasama. Ganun po ano. Kaya naman, part na sana po ito yung pananawagan natin na tulungan po sila ang sa ganun po.
Alam po. Meron dito. Kaya talagang low percent possible
Pwede din po yung surgical intervention, blood donation, lang. Pwede din kaya kasi nga nakikita lang pag nataas na yung viral load. So maraming ano po, and it will also depend on your body's capability to suppress the infection. So maraming we cannot judge, be judged for the
kasi kanina ma'am, may mga ah ah,
wala po kami ilan. Okay. Hindi po nasa, hindi rin po nasa loob lahat. So, po yung datos din po is for the province. So, ibig sabihin, all of the 71 nandito or lahat.
so yun ang important po kasi ah para at least nasa labas siya paano yung andito sa katuan ayun sila sila dito pero kung taga saan numbers lang hihingi ko para mas klaro kung ilang
Wala na po kasi sir na clients. Kung hindi po silang nandito sa Catanduanes, hindi po natin na hindi naman yan, oy, oy, paalis na ako, na ngayon akong star. Diba? Kaya, yun nga, ano ba, sa treatment, kami po, wala po kami sa ano namin yun, sa, ang, ang meron lang, siguro makakaalam yan, kung saan sila nag
ano siguro Talaga. Ano?
So much, Sir John.
So, dagdag na lang po, sir. Supposed po na may nag-expect sila ng HPV. Ano po yung ma-advise para sa mga nakaka-experience nila? Pero natatakot sila.
Counseling. Marami na tayong pwedeng malapitan. Marami nang pwedeng malapitan. Meron na pong para para
Parang nag-voluntary po sa high risk. Ano po? France, test, voluntary.
To get
Sabi at one-stop shop. Hindi na yan sasabihin na ito yung case. So, kung i-refer to no question. I-refer to among the muli, reintegration to the so, with simple job. So, i-refer
dapat na samples. Hindi na sila pwedeng tanggapin sa yun lang.
part at sa speaker uh, so may I repeat na po ang at part ano po of form um so ito po ay very important po para malaman po part po kami sa programs na so mula po sa DOH kami po ay nagpapasalamat sa inyo pagdalo at oras sa aming press conference at sa mga bisita po na narito ngayon po kami makita ang suporta para sa mga aktibidad DOH. Muli, magandang araw po sa ating lahat. Magkita-kita po ulit sa susunod na aktibidad. Salamat po.